So I believe our first presenter, Dr. Supattra Rungmaitree, will be presenting on age-related non-communicable diseases and organ system impairment in adolescents and young adults living with perinatal HIV in Thailand.
Good afternoon, Chairman, Co-Chairman, and everyone. It's my pleasure to present our study, Age-related non-communicable diseases and organ system impairment in adolescents and young adults living with perinatal HIV in Thailand. Despite the benefit of combination antiretroviral therapy in HIV-infected patients, the worldwide prevalence of non-communicable diseases, or NCD, are increasing in HIV-infected adults who receiving ART. These NCDs such as dyslipidemia, obesity, and metabolic syndrome. Adolescents and young adults who have grown up with perinatally acquired HIV or ARP-HIV have been exposed to decades of chronic HIV and long-term ART. ARP-HIV face substantial health challenge and may have similar HIV-related comorbidity patterns as adults. The objective of this study was to describe age-related NCD risk for dyslipidemia, obesity, hypertension, metabolic syndrome, and diabetes among Thai ARP-HIV, and this study is a part of main research Thai program to actively follow perinatal adolescents and young adults living with HIV or PREPARE study. This is a cross-sectional study among ARP-HIV aged 18 to 25 years across 5 pediatric HIV clinics in Thailand. We conduct a study between November 2020 to July 2021. The demographic and clinical data were extracted from: first, is site-based medical records; second, the research cohort data; and third, Thai National AIDS Program database. And all data were harmonized using a unique identifier. This study has been approved by local IRB at its study site. The NCD in the study included dyslipidemia, obesity, hypertension, and metabolic syndrome were defined according to International Diabetes Federation and U.S. National Cholesterol Education Program Adult Treatment Panel 3 criteria. For dyslipidemia defined as low density lipoprotein or LDL greater than or equal to 140 mg per deciliter, triglyceride greater than or equal to 150 mg per deciliter, cholesterol greater than or equal to 240 mg per deciliter, high density lipoprotein or HDL less than or equal to 40 mg per deciliter for males and less than or equal to 50 mg per deciliter for female. Obesity defined as body mass index greater than or equal to 30 and BMI greater than or equal to 40 for obesity. For hypertension, defined as blood pressure greater than or equal to 140 over 90 mm mercury, and metabolic syndrome, defined as presence of any 3 out of 5 of the following. First, central obesity, defined as waist circumference greater than or equal to 102 cm for males and greater than or equal to 88 cm for female. Second, TG greater than or equal to 150 mg per deciliter. And third, HDL less than 40 mg per deciliter for male and less than 50 mg per deciliter for female. Fourth, blood pressure greater than or equal to 130 over 85 mm mercury. And fifth, fasting blood sugar defined as greater than or equal to 100 mg per deciliter. And for diabetes defined as fasting blood sugar greater than or equal to 126 mg per deciliter. And for the result, this table shows baseline characteristics of ARP-HIV. Of 350 ARP-HIV, 46% were male with a median age of 21.8 years. Half of ARP-HIV received NNRTI-based ART regimen, 35% received PI-based, and 14% received integrase-based ART regimen. For the NCD-related list, we found that 58% of ARP-HIV had dyslipidemia, including high LDL in 13%, high triglyceride 21%, and low HDL in 44.5%. And 5.5% of ARP-HIV had obesity. 1.5% had elevated blood pressure, and 2.6% had metabolic syndrome. And in our study, there was no case of diabetes. In the multivariate analysis, we found that the using of PI-containing regimen was associated with an increased risk of having at least one NCD-related list. When comparison among each antiretroviral therapy regimen, we also found that only the PI-containing regimen was associated with an increased risk of having at least one NCD-related list. Discussion. Our study found that 60% of ARP-HIV had at least one NCD-related list, and the most common were dyslipidemia in 58.4%, obesity in 5.5%, and metabolic syndrome in 2.6%. The use of PI-containing regimens was associated with increased NCD-related risk. Our findings are similar to previous studies among children and adolescents with HIV in Latin America, Spain, and Tanzania, but we had a lower prevalence of obesity than in South African study. The prevalence of metabolic syndrome in our study was 2.6%, which was lower than a 2014 study in Thai adolescents that found 4.1%. The limitation of our study. This is a cross-sectional data and was conducted at 5 tertiary care referral centers. This finding may not be generalizable to those in primary care and rural areas, and we lack of HIV-negative control participants for comparison. In conclusion, Thai ARP-HIV in our cohort had a high prevalence of NCD-related risk factor, and most common with dyslipidemia. And this finding called for scaling up NCD prevention, screening, and care in the comprehensive management of Thai ARP-HIV. Thank you.